In today's health headlines, how using marijuana as little as one per month can affect your health. The breast cancer death rate has dropped by 58%, and why next season's flu shot will include one less strain. Joining me is Dr. Arjun Venkatesh, Chair of Emergency Medicine at Yale Medicine and Professor at Yale School of Medicine. Welcome.
Hi, thanks for having me.
You bet. A large study found a link between marijuana use, even just once a month, and increased risk for heart attack and stroke. What can you tell us about this?
You know, there's a recent poll that showed that 9 in 10 Americans were under the impression that marijuana was harmless to your health. And I think that it's a mistake to think that just because something may now be legal that it's automatically healthy. It's true not just for marijuana, for alcohol, probably sugary foods, and a variety of things out there. What this study did is it looked at thousands of Americans, looked at their marijuana use, and found that people who use more marijuana were more likely to develop heart disease or have abnormal heart rhythms. And so particularly for people that are at risk of heart disease or have had recent heart disease or are worried about heart problems, I think you have to be really careful and thoughtful about marijuana use.
Advancements in screening and treatments have led to a 58% drop in breast cancer deaths. What about that? That's great news.
It's great news, and it's a success story, and sometimes it's hard to, you miss that in the rest of the stories that are out there about challenges in healthcare. Over the last 30 years, we have not only developed widespread use of mammograms, but even more newer diagnostic technologies, breast ultrasounds, breast MRIs. We've developed blood tests that can look for certain types of genetic types of breast cancers, and surgical care and chemotherapy care and everything else has improved. You put all those things together, and you have a more than 50% drop in deaths from breast cancer. And so it's a real success story. There's still progress to be made, and it's still important to get optimal breast care, but I think it's a real success story for modern healthcare.
Boy, you bet. And finally, next season's flu shot will only contain 3 strains of the flu instead of the typical 4, partly due to COVID. What about that?
Yeah, it's an interesting story. So for years now, over a decade, we have had flu shots every year that had 4 strains of flu in them, 2 type A strains and 2 type B strains. What's interesting is all the hand washing, all the mask wearing, and everything that we did to prevent COVID transmission over a couple of years seems to have potentially eradicated the type B strains. We don't see that type of flu anymore. And so the WHO recommended, and now the FDA committee just recommended in the past week, for next year's flu shots to no longer include the type B of influenza. It's possible it's gone. We could certainly come back, and if it came back, we'd have to change the shots again. But next year's flu shots will probably not include any of that type B influenza and focus just on the type A.
Very interesting. Dr. Arjun Venkatesh, thanks so much for being with us.